I will tell you why you require immunity balancing. See, everybody is asking immunity balancing and what is immunity balancing? See, I'll tell you an example. Immunity should be so strong that when the virus enters the body, the virus perishes then and there itself. That is an immunity in which the nasal secretion has a lot of antiviral agents, biofenols could be, for example, curcumin. It's one of the good biophenols. Like that, a lot of plant extract is there even in the secretion of the nose or in the secretion of the throat. Enough and more bactericidal enzymes there. So that is one of the high quality immunity in which the person don't get sick. Second is a high quality in which suppose the virus has bypassed, then the virus is destroyed by the lymphocytes, which is present in the tonsils, which is present in the stomach, and which is present in the lungs. Okay. Third is virus, suppose it has bypassed these areas and entered into the bloodstream or into the local epithelium. So at that time the virus is contained in the cells with minimal damage, in which virus multiply very slowly, and whatever virus that multiplies is being taken care of by minimal amount of WBCs. This seems very surprising. It's like a terrorist enters a country and minimal amount of soldiers like commandos are going to destroy the virus. That is the best kind of immunity. So what are the variations, imbalances? An allergic kind of immunity in which there is a lot of secretions happening, and that kind of phlegm can block the airways and cause ARDS. And second variety is a hyperinflammation kind of immunity in which lot of WBC is coming into the lungs, and the amount of destruction the WBC is caused to the virus infected cells is going to itself peel off the epithelium and damage the lungs. That is another kind of bad immunity. Now, why you require to balance the immunity is one thing, to effectively kill the virus, and second thing is to kill it without destruction of the body. The two things are very important. For that, as my previous video I have mentioned, the viral load should be less. So why the viral load is not going to be less in the near future? Because in India for past 30 years people are not ready to wear helmets. Even after imposing of 1,000 rupees fine, people are not ready to wear helmets. How do you expect the people to wear masks? It is going to be impossible. For every person, you are yourself. The government is not able to impose this mask to all people. People of India, not illiteracy. It is just a basic genetic mechanism by which we are not ready to follow the rules. Now, in addition to that, there is a news that in Meerut, all the samples which are supposed to be biohazardous, after testing, were taken away by the monkeys. Congratulations. Now the viral load is going to increase. And shortage of doctors. For example, certain doctors, one of the doctor has won KBC, Kaun Banega Karorpati, KBC Junior, way back in 2000, and he has done MBBS and he opted for IAS. So such are the smart doctors who are not ready to work. They are going to opt, and he is not smart. He is now posted in Porbandar in Gujarat. Lucky he is posted in Porbandar. Otherwise, if he would have taken doctorship, he would have become a bandar. Bandar means monkey in English. So another thing is, even doctors are unaware of how severe this disease is. Many of the people come asymptomatic. Even many of the doctors thinks if they have a good immunity, they will be saved. It's not about you who is concerned. Even if you work 1 hour extra unnecessarily, you could have taken an appointment and cluster your patients, send them quickly within 10 minutes, rather than take history over phone, fill your details over phone, just check them, examine them and send them away. Don't allow the patient to wait in your waiting area, and many things doctors can do. There is an incident in I don't know, Uttar Pradesh, somewhere in North India of Kerala, in which the whole IMA Indian Medical Association, the whole get together meeting group, the whole people, all group of doctors were quarantined because one radiologist did not follow the quarantine protocol and was tested positive. The whole area is going to get quarantined. The doctors are not there, and who is going to save you? That is why you need immunity balancing. Another thing is, there are many family functions still happening. In-law from Jiju, we call it. A person attended his sister-in-law's marriage. It was in Madhya Pradesh. He took some bus or train, somehow drive using a car, and he reached from Delhi to Madhya Pradesh, and he spread the infection. He was tested positive, and all the family, bridegroom, everybody is quarantined now. That is why you require immunity boosting. This is going to be really funny. The Supreme Court want the corona treatment to be freely provided by the private colleges and private hospitals. Are you really crazy? Treating a patient without using personal protective equipments, each set of personal protective equipments are going to cost 1200 rupees. Doctor is not going to pay from the pocket. They are going to reuse the personal protective equipments. That is going to be more harmful. And what about the electricity bill? What about the other bills? Government is not going to make it free. They are giving subsidy of 20 lakh crore rupees to all the people, but not to the private institution. No doctor is going to be ready. We better close the hospital and stay at home. That is going to be. That is why you require immunity balancing. Because even after the rule of Supreme Court, it is not logical to do these things. Doctors can't save you. I'll repeat. It is your immune system which is going to save you. That is why you require immunity balancing. Now, certain hospitals are going to be taken over by army. Army thoughts, goli de to theek ho jayega. I'll tell the meaning in English. Goli means tablet. Goli also means gun. It has two meanings. It is a Hindi word which has two meanings. Goli means tablet. Goli means gun. So army taking over the hospital is not going to solve the issue. And another thing is, people like Sonu Sood, actor, they are doing wonderful job sending the migrants to the home along with corona. This is not going to solve any crisis. It is just a humanitarian job. Let him do. He is getting happy with that. But the doctors are trying to save these people who this massive travel has caused to spread the corona. This much amount of doctors are not there. And another person, every positive case which is happening and going to the hospital, doctor checking, they are closing down the hospital. Only private hospital. Same in the government hospital, they can't close it down. It is continuing to spread the corona. Government hospitals. And one person from this government hospital of Chandigarh only has spread it to the whole Bapudam colony. So such is the stupidity of these government people. It is not the hospital which is the cause. It is the protocol which is the cause. Now one friend of mine who was in police, he died because the protocol was that you have only fever, you take paracetamol, you are not going to get tested for corona. Because you need to be health worker to test for corona. You need to test the police also. Because they are in the forefront. Not only health workers, police, the traffic police, the normal police, even the army personnel if they are deployed, everybody is getting banker, they also need to be tested. This is not, you can't create a protocol without asking the doctors. This is stupidity. And there is no protocol during emergency situation. Doctor need to have an intuition. If this person has exposed, just test it. Any fever, you test it. That is what Germany has done. Multiple testing. Enormous testing. Anybody with fever, test. Early diagnosis, set it up. Early immunomodulation. That is why you require immunomodulation. Because the government is telling that only respiratory distress they are going to test. By the time you get respiratory distress, you are gone. 50% chance of survival. Best of the best results in a ventilator, 50% chance. That is why you require immunomodulation. I'm telling you this video is for importance of immunomodulation. Now people are telling they require 10 acre for building a medical college. The government should ease the rules. MCA should ease the rules. Small medical colleges need to be started. Medical colleges won't cure you. Even if you teach a doctor to become a doctor and handle the ventilator after 10 years of training, there's only 50% chance that you will survive. But immunobalancing, you will have very enormous amount of survival, because even 100% you can survive by if you are having a balanced immune system. That immune system which doesn't produce too much of phlegm, and that immune system which doesn't produce a lot of inflammation less, phlegm less. Such a balanced immune system, no low immunity or no very high autoimmune kind of destructive immunity. A balanced immune system, that is important. Now people are telling, more advices are coming, that the registration of doctors will be cancelled. This is not going to save you. Even if the doctor is willing to sacrifice his life for the patient, the chance is only 50%. The government should focus on people's immunity. And if 80% is asymptomatic and mild, everybody should wear mask. Since asymptomatic and mild it is there, everybody should wear mask. Otherwise, if you see people without mask, you wear 2 masks. Let whatever happen in the world happen. Now the positive thing, why it is still not dangerous, even if 1 lakh cases happen daily, 1 lakh cases happen daily, to infect the 135 crore, that is 135 into 100 lakh people of India, it is going to take 40 years. The majority of Indians are still safe, but near and dear ones who are elderly, who are sick and having comorbidities, they are not safe. That is why, even if you are too positive and too relaxed, you need to balance your immune system, because it's everywhere. Corona is everywhere. It's asymptomatic, it's invisible, and only your strong immune system and a good quality mask which you need to wear regularly can help you. Now next video will be about details of immunobalancing. Today's video was why you require immunobalancing. So I'll summarize today's video. Threatening the doctors is not going to help. Even the monkeys have taken away sample in Meerut and they run away. And even people who are smart and won the KBC Junior and taken MBBS, they are becoming civil service. Bureaucracy and protocol is not going to save you. Shortage of doctors, even if you relax the MCI norms to start new medical college, it is going to take 10 years. The number of ventilators, still your chances is only 50% even if you get a ventilator. The number of testing, it is impossible in a country like India with 135 crore people. Good thing is that even if 1 lakh get affected daily, still it will take 40 years. But your immune system will guarantee, if it is balanced, that you will survive. If your immune system is not balanced, even if you close the hospital, quarantine the doctors, even if you threaten the doctors, even if army take over, nothing is going to help. My next video will be towards balancing your immunity. Keep sharing this video. I'm sorry that this is a very large video because it had a lot of news. So take care. Have a good day. Please keep sharing my channel and also subscribe.